Hello everyone, Dr. Santo here. Hope you're doing well. And I'm here with an amazing session today. And we are going to discuss the difficulties in understanding the concept of research question. And we will also answer any of your questions. So please do ask any question. Okay. And hopefully you guys will enjoy the today's session. If you have any question, do type because this is a live question answer session as well. Okay. This is a live question answer session as well. So you please do ask any question. Okay. And once you are here, please do type and let me know that you are here. And do subscribe to the channel and comment below that you have subscribed so I know you are here. And I'll come back and reply to you. Okay, I'll come back and reply to you. So let's begin. Let's begin. If you have any question, do let me know and give me a couple of minutes. Okay, let me make sure that everyone is here. I don't want to miss this opportunity for anyone to learn. So I want to make sure everyone, all of my students, have the link. Okay, thank you guys. I can see. Please do type hello as I can answer. Yes, Shitesh, thank you. Sindura, thank you. Thanks a lot. Anyone else? Please do type. I know I had a sudden session today, and I am seriously sorry about it, guys. My voice was gone. I was not feeling well. The whole last 10 days, my voice still is not perfect. I'm still not able to talk properly, but I'll try my best to have this session really well so that you guys really learn and enjoy. Thank you, Noshad. Thanks a lot. And we are all set. And just give me a second, just a couple of more minutes. Not a second, couple of more minutes. I want to make sure everyone has the link. Nobody is left behind. Nobody is left behind or forgotten. Lilo and Stitch. Anyone watch that movie? They said Ohana means family. And family means nobody is left behind or forgotten. Okay, just a minute, last 30 seconds, and I'm done. And please feel free to ask any question. I'm going to come to the questions and make sure I answer everything. And we are going to talk about the technicalities associated with research question. Okay, and I'm sitting outdoors today, not on the board. I hope you guys enjoy both kinds of settings. Anyone who has attended my setting on the board and anyone who has attended my outdoor session, you guys can tell me if you guys like a mixture or you guys like just the board. Just do let me know. Okay. I just had another meeting actually a few minutes back and just got rid of the meeting, long meeting. Okay, so let's begin. Okay, so we are all set. Mira, thank you. Noshad, SA, thank you, thanks a lot. And Nikita, thank you. Asma, thank you. How to generate tables and figures into discussion section for a systematic review. We'll talk about this. Asma has a question. After submission of a paper, how much time it takes for publication? Okay, through the channel. Yeah, 30 to 40 days. 30 to 40 days. If you have submitted today and you still think that you can get a publication before September 29th, the reality is that it is very difficult. It's already too late, and at least you can just say that you have already submitted. That's a good thing, that you have submitted before the match application began. And how to generate tables and figures into the discussion section? Well, use common sense. Each heading can have a table and figure. What did you find in that paragraph? You can just write it in a tabular form. And creating tables is so easy. Creating tables is so easy if you use the Word document. You can do it. Okay, now anyone else has any question? Okay, nobody has any question. Now let's talk about the important things that we must talk about today. The research question: must we compare review articles that are not studies, or can we just paraphrase the site? I have no idea what you ask. Must we compare review articles that are not studies, or we can just paraphrase and cite? What do you mean? Explain the question clearly. I have no idea about the question. I could not understand the question. Can you rephrase it? Make it really understandable. What exactly are you asking, essay? Hi Diksha, thank you. Thank you. So guys, let's begin. Let's talk about the research question. So what is a research question? How do you start your paper once you have decided your topic, right? Your topic is a broad-based topic, like for example, Alzheimer's disease and XYZ medication. You're looking at the association, or Alzheimer's disease and Parkinson's disease together. See, I'm still not able to speak really well. My voice is not supporting me, but I'll try my best, okay? So I should not be that loud today. So the thing is, guys, when you combine two things together, you have a topic at hand, but that can also be a research question. But remember, while writing a systematic review, your research question can be of different kinds. Research question can be of different kinds. First of all, let's talk about the components of research question. PICO, right? We all, anyone who doesn't know the PICO concept. PICO. P for population or problem. P for population or problem or patients. I for intervention. C for control group or comparison of certain things, certain disease. Control, we'll talk about that. Control in clinical trial doesn't always have to be somebody who is not taking any medication. That's the reality. Many people think that control actually means that somebody who's not taking a medication. No, that's not true. Control, we'll talk about control. And O is for outcome. Okay, so this is a PICO question. I'll repeat again. PICO. P for population, problem, or patient. I for intervention. C for control group or comparison, and O for outcome. These are the four major components of a PICO question. But there are two more things that are known as TT. PICO TT. PICO TT. PICO TT. So type of study, T is the type of study and the time. Type of study and the time. So those are also the components, and these are optional. You don't have to have them, but PICO, PICO are mandatory. So now I have a clear question here. Okay, so the question is, traditional review, we summarize other articles, correct? Yes, and we compare them with each other. This is a part of discussion. You have to do it, no matter whether you like it or not. You have to do it, and it's not that difficult. It's not that difficult. Okay, now Naushad has a question. I'm doing a systematic review of traditional review and systematic reviews. Can you please give me a suggestion on how to extract data? Just look at their abstract. Each systematic review and traditional review. Look at the results section. Extract it from there. Look at the conclusion section and the results section. Main information is squeezed in there. Main information is squeezed in there. Usually if we include RCT, we will get data that matches, but including just reviews and systematic review, it has been a headache. That's, I understand. So rely on conclusion and the results section, and mainly the abstract. The abstract of a study will give you a good idea. How are we supposed to compare? Now, you also have the same question as Naushad's. How do we compare traditional reviews with another traditional review, right? That's the main question. So you have to see the abstract. You have to see the abstract, and this will give you an idea when you look at the abstract. Okay, so when you look at the abstract, it will give you an idea what that study actually talked about. This will give you a brief idea Then you go to the conclusion section of the full paper. That can give you major idea of the paper as well. And then you also look at the results section if it's a traditional review and there is a results section. Otherwise, just read the discussion quickly as soon as possible. But main information, you can extract the conclusion of that study from the conclusion section and the abstract. Conclusion and the abstract. So both of you, the answer to your question is the same. The answer to, I'm sorry guys, this is my daughter. She's playing over here with a game, so you will hear the noise. Okay. So I hope you guys can still hear me. Now let's talk about this. You have the abstract, right? You have the conclusion. So main information is in there. You just compare what is the overall squeezed result, overall conclusion of the study, one study versus another study, and that's how you can compare. I understand it is not possible to compare the whole discussion section. So that's why the conclusion section of a paper and the whole abstract will give you sufficient information and you can easily compare them with each other. Actually, this is a very good question that you have asked. I never thought this way, that this can actually create problems for many students. But I hope now I have made this very clear. Problem, both of you. And anyone else who has the same problem. Does it solve your issue? Does it solve your problem? I'm waiting. Please do type. Do type and let me know. Is there okay? So still kind of. So look at. Okay. So if you are writing discussion section of a study in which all other studies are just traditional reviews, or all other studies are systematic reviews. So look at the overall results and conclusion. What is the conclusion section saying? What exactly has this study shown? Another study, what that study has shown. Then you don't compare two studies with one another. You don't compare two studies with one another. You compare 4, 5, 6 studies, and they all can have the similar results. So you can say actually collectively all of the studies are saying the same thing. And remember, nobody writes a perfect paper. You can make mistakes. You will make mistakes, and um, gradually you will improve. And another thing is, maybe you are thinking it's a mistake, but the journal doesn't see that way, or the reviewers don't see that way. They appreciate your effort. So these are the things you need to understand, that compare the conclusion of one study with another if it's a review article comparison. But ideally, try to write a systematic review where you compare clinical trials and observational studies. Mainly move between observational studies and clinical trials, and occasionally there is a systematic review or a traditional review fit into it. But ideally you should try to have a comparison of observational studies with clinical trial. Now coming to PECO, there are two things. First of all, everyone write it down. PECO and PECO. Yes, PECO and PECO. PECO stands for population, problem, patient, intervention. I for intervention. P again, I'll repeat again. P for population, problem, patient. I for intervention. I for intervention. C for comparison or control group, comparison. O for outcome. O for outcome. So these are the components of PECO question, and the two optional components were T and T, type of study and the time. The more features you bring in, the more specific you bring, the lesser data you will find. So you should not go that specific and narrowed. Many people say that you should narrow down your topic. That's not true. This is something I would say the biggest misconception about a systematic review, that you should narrow it down. No, you cannot find enough studies if you narrow it down too much. Background noise is bothering you? Okay, give me a second. Okay, I hope now you don't have the background noise. No, you still have a background noise. Okay, so now it's better. It's better. Okay, so now remember the things you need to remember. PECO question, if you have all four components, it will highly likely become a meta-analysis because of the control group. So that is something you need to remember. But here you're writing a systematic review, and your effort is to attempt not to make a meta-analysis. Unless you are enrolled into a 3-month meta-analysis course that we offer. Of course, you guys will enroll into that course later. Right now, just focus on systematic review and traditional review. If systematic review is tough, to write, then just stay with a traditional review. If systematic review is tough to write, then stay with a traditional review if you don't have time. But if you do have time and you are not in a hurry, then go with a systematic review. And once you're done, then next time you can enroll into the 3-month meta-analysis course, and you learn to write and publish a meta-analysis, and that will be the culmination of your complete research. You will know everything about research once you have a publication of a meta-analysis. But right now, just even a systematic review is a king. It's not a joke. So let's talk about this. If you have a control group, write it down. If you have a control group, highly likely it will become a meta-analysis. If you have a control group from PECO, if you have C, PICO, if you have C, it will become a meta-analysis highly likely. So how do you prevent it from becoming meta-analysis? You don't have a C. You just have PIO. Now it will remain, now this will remain what? A systematic review of qualitative nature. Qualitative in nature. Systematic review of qualitative in nature, not the quantitative. Now, what if you have these three and you have TT? That will still remain a systematic review of qualitative nature, or although it can become a little quantitative, but will mainly be a systematic review. It will not be a meta-analysis. But if you bring TT, type and the time bound, like in 3 months, follow up in 3 months of these patients. Now, this will become a systematic review. It will not become a meta-analysis, but very few studies will be there. You will find very, very few studies. It will be very difficult for you. It will be very difficult for you to find relevant studies. Your goal, write it down. Your goal should be that your research question should be that broad. Write it down. Your research question should be that broad that you should at least find 100 papers in last 5 years in one database. Now I'm expanding further. In one database. If you can do that, you are moving in the right direction, and you can write a wonderful paper out of it. Now, This is clear about PECO. But now what is PECO? PECO. Can anyone tell me what is E? Because these are the basic concepts. These are the basic concepts of research that you must understand. These are the basic concepts of research that you must understand. What is, yes, very good. E is for exposure or exposed group, exposure, mainly exposure. So yes, or exposed group is there too. So you have a population, you have an exposure. Population is usually exposed group already. E for exposure, C is comparison, O for outcome. So if this is your research question, then this is known as PECO question. And that means the data you will collect now will be observational studies. Your systematic review will be of observational studies only. Many people say, I want to write a systematic review of observational studies. Did your research question focus on PECO? Was there an exposure in there? Common sense. I'm telling you the secrets, guys. I'm telling you those secrets that nobody unfortunately teaches. I don't know why people fail to learn this, and many people fail to explain this really well. I'm glad the teachers I learned from, they were really amazing. They taught me these things. So now, if you have a research question that is PECO question, write it down, PECO. Then that means you are focusing on observational studies. Mainly, what kind of studies will be included in your paper now? Mainly, what kind of observational studies? Because observational studies are of different types. There is a cross-sectional study as well. That's an observational study. Case series is also observational study. Case study is also an observational study. But whenever you see exposure, that means it's a cohort or case control. Cohort or case control. Cohort or case control. So that means half of your paper will be of cohort studies and half of your paper would be of case control studies. So can you have a paper of mixed studies? Yes, here you have two kinds of studies. Can you have paper of just one kind of studies? Like you have a PECO question, but it is focused on just cohort studies. Can you do that? Absolutely. Most people do it like that. But can you do cohort and case control together in one research question? Absolutely. Now, what about you have PECO, but can you bring a case report in it? Yes. In some case reports, you also have a history of an exposure. And what about a case series? What about a case series? Absolutely. By the way, most people in this world who are working on case series, I'm telling you with experience, guys, they don't even know what case series is. They're just doing it, wasting their time and deciding a wrong study design. Deciding a wrong study design. And we'll talk about that. Because the main thing is, guys, if you are embarking on a journey of writing a systematic review, your basic concept should be strong. And the basic concept is, the study designs. You should know every study design. You should know each study design that is related to research. If you understand research design, you will be able to understand research question. You will be able to understand systematic review. And in the end, you will be able to understand meta-analysis. Many people say, I do not understand systematic review. I do not understand meta-analysis. Research is so difficult. I don't understand research. The issue is that your basic concept is weak. You haven't strengthened your basic concept of research. Basic concept of research is the understanding of study designs. If you understand study designs, then you will understand research question. I know some people say that research question is the basic concept. No, research question cannot be basic concept for research. You cannot even understand what kind of studies you will include if you don't know what kind of studies are there in the world. and there are only limited kinds of studies. Everyone, please, right now, Google it. Let's learn the basic first, and then we move forward and do the research question analysis and understanding of the research question. So let's do it right now. Let's do it from the beginning. Let's do it from absolute zero. I don't expect anyone to know anything, and I don't want you to know anything. Let's say you don't know anything about research, you are blank, and you are sitting here for the first time, and now you are first time in your life studying about research. So how should we study? We should know how many kinds of studies are there. That's it. First thing first is how many kinds of studies are there. Of course, there is a basic definition of research. What is research? We are looking for an answer, finding something. Now, how can we do it? There are different types of research. What are the types? Everyone, please open study design pyramid. Go on Google and type study design pyramid. Pyramid as an Egyptian pyramid. Study design pyramid. So now we have a question here. What is the minimum amount of papers that we need to use in our systematic review? Did I answer this? I said you should look for 100 articles in the last 5 years, but minimum is 25. For my students, I want all of you, although there is no universal rule, a systematic review and a meta-analysis can be done of 5 studies only, but I highly encourage you to make a rule. The CIBNP rule is 25 minimum, maximum 100. 25 minimum, maximum 100. Although you can go more than 100, but just ideally 25 to 100. Minimum 25, maximum 100. If you have this in mind, you can produce a wonderful paper. So tell me once you have opened the study design pyramid, because now we are about to embark on an amazing journey where your research concept will be extremely strong. Are you guys with me? Have you guys opened the study design pyramid? Tell me, what do you see? Hurry up, guys, hurry up. I don't want a wastage of time. We want to make this time productive and useful. Okay, so on study design pyramid, whatever the kinds of studies you see, these are different kinds of studies. That's it. There's nothing more in research than this. I'm telling you a greatest secret. Stop getting scared of research. Yes, I have a good news for you. Stop getting scared of the word research, because there is nothing more in research than this pyramid. Everything is included in this pyramid. If you understand this, you understand the whole research world. Whole research world. If you understand this, you can understand any kind of research book. Any book on research methodology, any book on research analysis, any book on research design, any book on research studies, any title you tell me, any title you name, any type of title, you will be able to understand any title if you understand the study design pyramid, if you understand this concept. So let's begin. On the study design pyramid, take the most colorful diagram on Google. Use that one with maximum number of studies shown. At the bottom, we have in vitro test tube research, right? Those are the microbiology research, simple basic science studies, basic science microbiology research, in vitro test tube research. Then comes the animal research. We all know what animal research is when we have animals in the lab like rats, mouse, or we have monkeys, a rhesus monkey, rabbits, XYZ, guinea pigs, frogs, different animals, insects. So the one at the bottom is in vitro studies. Then comes the animal studies on the top. Then on animal studies, the third one is the ideas, opinions, and editorials. Then comes the case study and case series. Then the next thing that comes is Observational studies. There are three main observational studies. Which one comes next? Cross-sectional study. After cross-sectional study, what comes next? Case control study. After case control, what comes next? Cohort study. Then comes the clinical trials. Then comes the clinical trials. And then the last thing is systematic reviews and meta-analysis on the top. So you need to know what happens in these studies and how to identify and recognize and do the difference between these studies. That's it. So let's talk about this. In vitro studies are simple experiments in the lab, simple unicellular organisms, unicellular or skin cell, epithelial cell. You're just growing it and you are just observing what happens, and then you write it down. So it's kind of a small experiment on an organism. So they are simply in vitro studies. So if you see any study where you are talking about in vitro or cellular mechanism, microbiology, those are in vitro research. That is the weakest evidence, and that's why it is at the bottom. But you should know that, okay, this is this design. So if you are writing a systematic review where your research question is talking about etiology or the cause of a disease, or how it happens, why it happens, then in vitro research can be very useful for pathophysiology. So if your topic is of pathophysiology of two diseases together, two mechanisms together, to medication, then in vitro studies can be very valuable tool to add in your paper. Now you understand the point? Why study design pyramid is important? Study design pyramid has in vitro studies at the bottom, and if your research question is about pathophysiology of certain diseases, in vitro research can be very useful. So you will add in vitro studies. That's why it's important to understand the concept. You should know what studies should I include in my systematic review. If it's a pharmacology research, you are studying the mechanism of a drug. Again, you need in vitro research. You also need clinical trials. Yes, clinical trials are the best ones when it comes to pharmacology and pharmacy. Medication is involved, clinical trials, but always clinical trials and in vitro studies can be very, very useful in explaining the mechanism of a medication. Understanding a drug. So now you understand, if you are understanding a drug, in vitro studies will be essential part of your systematic review. If you are understanding the pathophysiology of a disease or of multiple diseases, in vitro studies will be wonderful, will be very useful. Because bacteria, virus, all of that. If you're studying the pathophysiology, let's say you're studying COVID-19, what studies you need? In vitro studies to study virus. What exactly happens in this virus? So if your research question is, although none of you should write COVID-19, okay? Journals are tired of it. Everyone is getting tired of it. Don't write COVID-19. Stay away from COVID-19. The next thing, after you are done with this, animal research. Okay, when do you need animal research? When you are studying a medication again, drug. When you are looking at the effects of a drug, you're understanding the mechanism of a drug, side effects of a medication. So write it down. When you are looking at the side effects of a medication in your research question, you are studying a medication, you are studying an intervention, even a vaccine, COVID vaccine. What kind of studies you need to collect? Animal studies and clinical trials. So clinical trial come here as well. Clinical trial comes here as well. This is clear, right? Now, animal research. What else can we do with animal research? Animal research can be just observational studies. Just a cross-sectional study. You have animals, you're just looking at their behavior. How do they behave? They were already there and you just collecting some animals and you're looking at how do they behave. But if you change the environment, you do manipulation, now it's an experiment. That's the difference between observational study and experiment. So animal study will be useful if you are studying pathophysiology. Is it? Yes. Sometimes. If you are studying a medication or intervention, is it? Yes. If you are studying the harm effects, harm studies, if you are studying harm, because in medication there are two kinds of studies. In one study you look at the adverse effect of our medication or a treatment, and in one study you look at the benefits of a treatment. So if it's a harm related study, then usually animal studies are the best tool. People don't try to test harmful effects on human beings. Use common sense. It's a good thing to do, bad thing to do, it's a different topic. It's a topic of research ethics. And I am a supporter of animals. So I have a different point of view. Okay, I have a different point of view. I believe that you should least use animals in research. That's my personal concept. Only use animals if the animals can be used to find a treatment for animals, not us. That's what my personal belief is. People can disagree with it. Some people say, no, just use animals because you cannot take, and they have a very valid point too. The scientists who disagree with this, they have a very valid point too, and I respect that. So now you understand we have in vitro studies. When do we use it? When our research question is studying a drug, medication, pathophysiology, a vaccine, mechanism. When we are studying side effects of a medication, harms of a medication, harmful effects. So write down harm studies. If you are checking the harm, your medication, you are studying a medication, harmful effects. Mortality in patients using high doses of valproic acid. Just for the sake of discussion. Just for the sake of discussion. If we are studying this, then you will see clinical trials and you will see animal studies. And what else? Can you see anything else? Cohort studies. How come cohort studies be helpful? Somebody who had already taken valproic acid. You did not give him the medication. Somebody who was already on valproic acid, now you look at and follow them up and you look at the side effects. Will they die or will they survive if they're taking high doses? So here now that you need three kinds of studies: observational studies, clinical trials, and animal studies, harm studies. And what about case studies and case series? They are also observational studies. And yes, in harm studies, you can do that. Let's move to the next. Ideas, opinions. No, case report. Yes, I said yes. If the case, let's say you are studying valproic acid, high doses of valproic acid, does it cause mortality? Now you can add a case report if the patient was already taking high doses of valproic acid. Now you can discuss that as an example, that this is what happened to the patient. And if the patient died, now you have a very valid point. So yes, case report can be added in harm studies. In harm studies, case report can be added, case series can be added. In harm studies, cohort studies can be added. And what about case control? Can that be added? Yes, because they may have taken that medication way earlier in their lives and now they have a disease, but actually you're studying mortality. So you got to be smart. Look at it. Patient is still alive, so you cannot assess mortality if it's a case control, because you have a patient. You have to have a patient. In cohort, you can assess mortality because the patients may die afterwards. I hope I make sense. I hope there is no confusion now. Am I clear, guys? Or am I confusing you further? Because, guys, I am not at my best today. Otherwise, I would have been on my board and I would have drawn all this and written it down and I would have explained it to you. But I hope now this makes sense. Are you guys confused further, or you guys are understanding what I'm saying? That why studying the study designs is important in order to understand research question and in order to understand what kind of studies you will include in your systematic review. So you need to know what are different kinds of studies. Okay, so first of all, everyone, come to a whole new page on your journal, whatever you are taking notes right now. Come to a new page and write down a heading, different kinds of studies. And today let's talk about all possible kinds of studies, so you know everything about research. So Virender, I understand that you have some confusion. Now that confusion, we are about to finish this confusion. Okay, write down types of research and we are going to talk about all possible kinds of research. Okay, we'll start from the bottom to the top. The weakest evidence at the bottom is, go at the bottom of the page. Go at the bottom of the page and write down. You're confused about case control. Oh, that's a baby thing. I'll explain to you. Don't worry about it. Case control and case series. That's what we'll discuss today, okay? And I can assure you nobody in the world can explain this to you the way I will do. I spent years and years of my career understanding the difference between these studies. And I'll tell you exactly. People don't know. Unfortunately, expert scientists with tremendous amount of experience, they cannot differentiate what a case, they cannot tell what a case series is. Okay, so the weakest evidence, the one that goes at the bottom, is in vitro test tube research. Then comes the animal research. Then comes the ideas, opinions, editorials. Put a cross right next to it because you don't need to include them in your systematic reviews. Ideas, opinions, editorials. These are the editorials written by the journal editor about his opinion, his ideas, what he thinks about this particular disease, what he thinks about this particular medication. So we don't consider them as a strong design. We keep it them here. But ideally, they should have been here at the very bottom because you are not doing anything at all. But the way study design pyramid was structured was because of the relevancy or how relevant they are to the human treatment. That's why they are designed this way. So study design pyramid is designed because of two things. This classification, why in vitro studies at the bottom, is because of two things. First of all, they are least relevant to human treatment. Number one. Second is they have more chances of bias. So as you move up the pyramid, as you go up, as you climb up the pyramid, you're going from in vitro to animal, then case study, then case control, cross-sectional, case control, then cohort, then clinical trial, then systematic review and meta-analysis. Systematic review and meta-analysis are the highest quality of evidence with least amount of bias. And they're more relevant to human treatment. They're more relevant to human treatment. Does that make sense now? So this is the basis of this study design pyramid. Now, in vitro at the bottom, write it down, then animal studies, then ideas, opinions, editorial, but put a cross right next to it because you don't need them in writing a systematic review or even a traditional review. Then comes the case study and / case series. Case study / case series. Case series / case series. Case study / case series. Case study / case series. Now comes the cross-sectional study over case series and case study. You bring cross-sectional studies. Then you bring case control studies, case control. Then you bring cohort. Then you bring clinical trial. Then you bring the systematic review and meta-analysis. That's it. This is all different kinds of studies. So how many boxes do we have actually in a pyramid? 9, right? but actually we have more than 9 studies, and we can further explore and expand. We have like 13, 14 study designs, I would say. So we have animal studies at the bottom. We have, sorry, in vitro studies at the bottom. We have animal studies after that. And animal studies themselves can be experiment and observational. Put an arrow. Animal studies can be experiment and observational. Same with in vitro. They can be experimental, they can be observational. Most of the time, they will be experimental in vitro because you must do something, right? Now, the next thing is the ideas, opinion. I told you, just put a cross right next to it. You don't need them. Then comes the case study and case series. So, what is a case study? Case study is an observational study of one person or one unit. When you are studying one person, one patient, one unit, person, place, or thing, yes, it can be a person, it can be a place, it can be a city. Writing a case study on San Francisco, writing a case study on the city of Mumbai, writing a case study on the city of Cairo. These are the case studies. So case study can be of a city, can be of a place, can be of a historical place. Egyptian pyramid. Case study is of one person, place, and thing. Now, what do you do exactly in case study? You just observe. That's why it is an observational study. You don't do anything. You just collect data from people who are participating. So let's say you have a case study of one patient. So you will go to that patient and you will collect all the information from that patient, taking a history, and you will take the blood reports, you will take the x-ray report, you will talk to the primary physician, you will talk to the family, and you will combine the information collected from different sources about this one patient, and then you have a report, and then you write the report down that what actually happened to this patient. And usually what do we study in a case study? Rare disease. We study a rare disease in a case study. We study a rare disease in a case study. Or if it's a common disease, can we still do a case study? Yes. Common disease, but some rare symptoms. For example, COVID-19 patients. Everyone knows now what the symptoms were, but somehow a new patient came with stroke. COVID-19 patients can have stroke. Now, a new story. Okay. And that is true. I'm not kidding. I heard there were some cases where patients got stroke in COVID. So they're still studying what happened. So that's a very good case to do a case study. Very sad case to do a case study. Not a good in a scientific way to help other patients in the future. But this is reality that this happened. What else? Rare symptom. Rare symptom of COVID. Arthritis doesn't usually come, but some patient has arthritis. So you study this patient that he has COVID-19, but he has this rare symptom of his knee arthritis, and we are studying why he developed this septic arthritis. Oh, is it a septic arthritis, or is it just an inflammation? So case study. Remember now, in case study, you study a rare disease, or you study a common disease but a rare symptom, or a rare treatment. Can we do a case review on ourselves? Yes, you can. Actually, that's very few people know this, but yes, you can. But there is one condition, one hallmark feature. Everyone write it down in the bracket. The hallmark feature of case study. Multiple sources of data. I can bet on this. Besides me, nobody else will tell you this. I spent all of my life studying research, guys. I'm telling you the definition of case study that nobody else tells. I don't know why. Very few people have mentioned this. And I just found this in one book. I forgot. I'll share that book with you guys. And I think I should give credit to that scientist who was the first one who mentioned that in his book. What's his name? Starts with Y. I think Yin Yin. I think, yeah, I think Dr. Yin. Yin Yin. Dr. Yin in his book mentioned this hallmark feature of case study, and it is multiple sources of data. If you go and ask anyone who knows anything about case study, 99% of the time people will just tell you, oh, when you are studying one rare patient, that's a case study. No. When you are studying a rare patient or a common disease with rare symptom or a common disease with rare treatment, that's a case study if multiple sources of data are utilized. So can you write a case study on yourself? Only in one condition. If you can collect more data other than your own self. Your self given history is not sufficient to make it a case study. Let's say if I write down a case study on myself, and I'm writing a case study on myself that I'm this, I'm this, I'm this, I have this, I have this, I have this, and this is because I know myself, so I'm giving you this report. Is it a case study? No, it's an essay. It's not a case study. I need to involve my doctor's testimony. I need to involve my lab reports. I need to involve my close family members' testimony and history. Now, does it make sense? Rashad, does it make sense? If you write a case study on yourself, you want to make sure that you have multiple sources of data. Otherwise, just an essay. Doctors report biopsy findings and lab. Yes, that's the now it's multiple sources of data. Now you can write a case study on yourself. Very good. But if you say that no, I'm myself my own patient, and my story, I know my story, I'll just write down my story, my history, and that's a case study. No, because there's only one source of data, you yourself. Nobody will accept it as a scientific evidence unless they don't know what case study is. They will accept it. But a person like me who knows what case study is, he will not accept it as a scientific evidence. I will see, did you include lab reports? Did you include blood reports? Did you include X-ray findings, the CT scan, the imaging? Did you include family history? Did you include not your family history by yourself, a history taken from your wife or from your husband or from your brother? About you, the testimony of your doctor. So yes, you can write a case report on yourself. And now what is the difference between case report and case series? Write it down, everyone. Case report and case study. What is the difference between case study versus case report? You must have heard this word a lot, right? Case report, case report, case report. Then what is a case study? A study done is a case study. When it's written, it's called case report. How do we get testimony from a doctor? Go to your doctor, primary care physician, and you say, can you please tell me what you have seen in me? What you have observed in me while treating me when I had this problem? Because I'm writing a case study and I need another opinion. Or you give him a questionnaire to answer. Does it make sense? And do you need IRB approval for case study? Technically, no, but yes, if it's a hospital patient and they have IRB board, then you should go and ask for approval, because some journals may ask for it. But most of the time you don't. So that's a lucky thing. So that's why you can write a case report on yourself. You don't need an approval. If the journal asks for it, that's a different story. Then you must collect the IRB approval from the hospital where the patient was from. But if it's about you, then you just mention to the journal that, it's my own personal case. We have collected data from doctors and multiple people, so it's a pure case study, and it was about my own case, so I have given my own consent. So I'm the patient, we don't need IRB. Just tell the journal. Make sense? So now, sorry guys, the camera is moving. Okay. So anyways, now let's talk about this. So what is the difference between case study and case report? Case report is written, case study is only done. Until it's written, it's called case study. Once it's written and ready to be published, you call it case report. So when do you need case reports and studies to be included in your systematic review? When you are studying the harm effects, beneficial effects. Yes, harm effects, beneficial effects. So yes, you can do that. Risk factors, PECO, yes, because you may be exploring an exposure, rare exposure of a common disease. So it all depends on your research question. Look at your research question and think about it. Am I focusing on exposure? Okay, so what studies can I include? I can include a case control study. I can include a cohort study. Can I include a clinical trial? No. Can I include a case series and case study? Yes, if they are related with somehow with the case exposure. I hope now it makes sense. Guys, I'm saving you your 20 years of your life because the information I'm giving to you is so valuable. You spend whole of your life and finally probably in after 20 years you will come out with the differences. I'm saving so much of your time today. So this lecture is extremely valuable. Listen to it again and again. Rewind it again. Take notes. I'm saving you so much of your time. You don't have to read thousands of books, hundreds of books. I collected this information, all of this about the study design and the concept, the basics of research by reading, I don't know how many books, I don't even have a number. I went to libraries, I read online, I read every single book I could find online on research that was free available on PDF. Any book I could find that I could pay the hard copy from Amazon, I got it. Or other libraries, other different. I went to libraries just to read research. Here, local library, we have free books here. You can go, but you cannot purchase them. You can just bring it home for 21 days and then you return it back. So whatever books I could find, I collected all this information. So I'm saving so much of your time. Please understand the value of today's lecture. It's extremely important. And I don't think we will be able to finish everything today. So we will continue this tomorrow. Tomorrow, the same time afternoon, if you guys are available, or Saturday. Let's do Saturday. Tomorrow I have a meeting, I forgot. Let's do Saturday. And we continue from here and we will discuss more about the study designs. Once your concept is really, really clear and strong, then you will have no problem in doing research or doing your systematic review, doing your meta-analysis, or understanding your research question, what studies to include, what studies not to include. You will never have any problem. Now let's talk about the next thing. Case series. What is a case series? To understand the case series, you should first understand how many kinds of case studies are there. Remember, there are two kinds of case studies. Please write all of this down on that page where you're drawing and writing the list of the study designs. Single case study, multiple case study. Yes, if you have one patient, you are doing a single case study. If you have multiple patients, multiple COVID patients, 3 or 4 multiple patients, 3 or 4 patients in a hospital, all have COVID, but they all develop arthritis. Common disease. COVID is a common disease now, right? It's not a rare disease anymore. It's actually the most common disease in the world right now. So COVID, common disease, can we do a case study? Yes, because symptom is rare. One symptom is rare. So we are studying the arthritis in COVID, knee arthritis in COVID, okay, lower limb arthritis in COVID, make it more rare, just knee. So you have 4 patients, it's a case series. Sorry. You have 4 patients, it's a multiple case study. You have 3 patients. If you have 3 patients, again, what do you call it? It's a multiple case study. You have 2 patients, let's say. How many? You have 2 patients. So what do you call it? Multiple case study. But if you have 1 patient, you call it a single case study or simple case study, or single case study when you have 1 patient. When you have 2 patients, it's multiple case study. When you have 3 patients, it's multiple case study. When you have 4 patients, it's again multiple case study. But the moment you cross more than 4, you call it case series. Now, this is very important. There is a disagreement among scientists. Scientists are still struggling to define how many people should be there in a case series. There have been cases with 6,000 patients, 1,000 patients, 100 patients, 50 patients, 20 patients, and they all have been called as case series. So yes, they can be case series. But I am among those scientists, or I support that group of scientists that believes that the case series should actually have 4 plus to 10, 5 to 10 patients. If you have 5 to 10 patients, it's a case series. If you have 5 to 10 patients, it's a case series. If you have more, it can also be a case series though. But again, it can simply be an observational study. You can call it a cross-sectional study. But again, now multiple sources of data is the key. So there are some differences that you need to understand how you recognize a case series. So remember, in case series, the sampling is done on the basis of outcome. Write it down. In case series, the sampling is done on the basis of outcome. You already know the outcome, what outcome you are studying, and you are doing the sampling on the basis of that they have already developed that, or they are about to develop this disease. So yes, case series can be retrospective or prospective. Write it down. Case series can be retrospective and prospective. That means case series, you can go into the future, the outcome or the disease has not yet developed, or the disease or outcome has already developed. And when you started, you are just seeing what exactly happened when they developed. Or when will they develop? So in case series, you are looking at the overall experience of a population. What will happen or what already happened. But the sampling should be done on the basis of outcome. Now, another point, can case series have sampling done on the basis of just exposure, not outcome? Remember, outcome will always be there. If you want to do case series and you are doing sampling on exposure, make sure you again do that. You do the sampling on the basis of both exposure and outcome. So there are 2 ways of doing the sampling. That means when we are starting our experiment, when we study, when we are starting our study, when we are starting our case series, we can start by sampling on the basis of outcome only, or on the basis of outcome and exposure both. We can have a continuous case series or non-continuous. What I mean by that is, continuous case series means that whatever patients were present, you just included them. Whatever patients you found, you just included them. Non-continuous means you just chose selective patients, alternate patients. So how different is case series from case study? Remember, in case study, you did not do sampling on the basis of outcome or exposure. You just collected one case, a rare disease or a patient who had common disease with rare symptom. That was your patient. That was your patient. But it could be without an outcome. Simply the patient is taking a medication. In both, you will have multiple sources of data. Now, another hallmark feature of case series, write down, only one group. You will have only one group of similar patients with similar outcomes. Similar patients, similar outcomes. Only one group. So write it down. The hallmark feature of case study, multiple or single, was multiple sources of data. But the hallmark feature of case series was one group and sampling on the basis of outcome. Now, cross-sectional study. Next is cross-sectional study. What is a cross-sectional study? You are studying the prevalence of a disease. Survey studies. These are called as survey studies. Prevalence of a study, survey studies, and you also call them as snapshot. Just like a census. When the census people come to your home and ask for how many people live in your home, that's a cross-sectional study. Simple survey study. What is happening at one point in time? Cross-sectional study. What is happening at one point in time? You are just looking at the prevalence, the disease that is already present. You're not looking at the new cases. That's the difference. Prevalence actually means the cases that are already there in a population. And cross-sectional study usually has a bigger population. Of course, more than 10. And usually they are the survey studies. All of these case control, cross-sectional, case study, single case study, multiple case study, case series, and the observational studies, all of them, the cross-sectional studies, all of them are known as descriptive studies. By descriptive studies, we mean that we are just exploring what is happening. We are not doing the why. We don't have an analytical group. So in cross-sectional study, you don't have multiple groups. Write it down. In cross-sectional studies, you don't have multiple groups. But I have seen a study, a cross-sectional study, in which there were two groups. So yes, you can have two groups. You can have two groups in a cross-sectional study, but very rarely. But most of the time, only one group. That's why it's called as descriptive study. The moment you have multiple groups, you call it an analytical study. All of these are names you will remember with experience. With time and with experience, you will understand what the scientist is talking about. So case series and cross-sectional study. Now the difference. The sampling was done on the basis of outcome in case series, right? Or the sampling was done on the basis of outcome and exposure, right? But in cross-sectional, you don't do the sampling on the basis of outcome. You do sampling of a population that is living in one locality. They have similar features. There are different ways of doing that sampling. You collect people all together, but you don't do on the basis of outcome. In both, you have one group. Cross-sectional has a bigger group, cross-sectional study, more than 10. Case series has 5 to 10. 5 to 10, 5, how do I say? 5 to 10 patients is case series. Less than 5 is case study. Less than 5 is case study. From 1 to 4. 5 to 10 is case series. Plus 10 is cross-sectional. But cross-sectional can also have lesser patients, but that will be a very weak study. But yes, you can do a survey of 5 people, but then sampling will not be done on the basis of outcome. And you're just studying the prevalence, not the incidence of a disease, not the new cases. People who are already there in a population, you are just getting their point of view. So usually survey questions. Whenever survey questions are given, they are observational studies of cross-sectional studies. What is happening at one point in time, and only one time you collect data. You collect data only one time. You collect data only one time. That's known as cross-sectional study. But if there is a survey study where you collect data multiple times, if there is a case cross-sectional study in which you collect data multiple times at multiple intervals, then you don't call it a cross-sectional study. You call it a longitudinal study. Just the name difference. Same concept. In longitudinal study, you are also studying prevalence, if it's a survey study. And in cross-sectional study, you're also doing a survey at one point in time, at multiple point in time is longitudinal. Whenever you interact with the patient multiple times in the future, that's longitudinal. So survey study can be longitudinal in nature as well. This is clear. Next is case control. Now, who was asking what is the difference between a case control and case series? Let's talk about this. Case control, you go into the past. Case control, you always go into the past. It's always retrospective. Case series can be retrospective and prospective both. You may go into the past and you collect all the information, that everything that was already done. The disease was already done, the intervention was already done, the risk factor was already done, exposure, they were already exposed. This is a retrospective study. Prospective study will be when you see the disease being developed or the outcome being developed. That's a prospective case series. But in case control, you always have a past. You always go into the past. You start the study with patients, so your outcome based. The study is outcome based. The sampling is outcome based. The sampling is outcome based. Just like case series. So who will tell me the difference now? In case series, we are going into the past and future both. We can do that either way. But in case series, in case study, no, sorry. Let me repeat the name again so I don't confuse you. In case series, we can either go into the past or we can go into the future. So we have retrospective case series and prospective case series. That's clear, right? But now we can also have a case control study in which you just go into the past. So now how do you differentiate between a case study, case control study in which you go into the past, and the case series in which you go into the past? Because remember, in both, the sampling is done on the basis of outcome. You have done the sampling on the basis of outcome. In both, you know the outcome. So what is the difference? Who will tell me the difference? Anyone who tells me the difference gets a prize from me, wins a gift. Anyone who answers today's question, that in case series retrospective, we go into the past. In case control retrospective, we go into the past. Case control is always past. Case series is not always past, but we go into the past in both. So let's say you have a case series retrospective, you're going into the past, so everything is already developed. And here you have case control study, you go into the past, already developed. What is the difference? And Hadia has won the prize. You won the gift. I'll give you one free course by CIBNP that is not on your account already. I'll give you as a gift because you answered the correct, you have given the correct answer. Case series only has one group. Case series has only one group. Case control is telling you that it has two groups, cases and controls. The one with the disease without the disease. Okay? Case control has cases and controls. Yes, you also get the prize. Okay. We'll give you an extra course as a gift. See that now? Magic. In case control, what do we see? Risk factor. We are studying the risk factor, but focus is on the disease, how this disease developed. We will go into the past and see what risk factor they had used or they were exposed to. Let's say they were smoking. Most common example is given of smoking. These patients 10 years ago they were smoking, and all of these patients, 100 patients, 50 are control, 50 are not cancer, 50 are cancer patients, lung cancer patients, 50 are control. They have no cancer. You go into the past and you notice that the people who smoked, 40% of them developed lung cancer, and those who did not smoke, only one developed lung cancer. So you made an assessment with this result that okay, smoking is a risk factor. So you actually are studying a risk factor. But in case series, you not always study the risk factor. You also focus on intervention, a treatment that was already done, usually a surgical procedure that was already done. Once that is done, now the next one is the cohort study. Now we have two kinds of cohort studies. Again, prospective and retrospective. In one, you go into the future, in one, you go into the past. Now, the one in which you go into the future, you call it as prospective cohort. The one in which you go into the past, again, repeat, hold on. I don't want to make sure, I want to make sure I didn't make a mistake. Cohort studies are of two types. The one in which you go into the future, they are known as prospective cohort. The one in which you go into the past, retrospective cohort. Sampling is done on the basis of exposure in both. In cohort studies, whether retrospective or prospective, the sampling is done on the basis of exposure, not on the outcome. So if ever anyone asks you what is the difference between case series and cohort, because in both you can go into the future and past, what is the difference? Sampling is done on the basis of exposure in cohort because you are actually focused on exposure. In case series, the sampling is done on the basis of outcome, sometimes exposure too. But you will always sample with exposure and outcome both. So outcome is mandatory. Another difference, cohort studies are humongous. They have cohort is a big number of people, right? They are big people. I mean, a big amount of people, 100 plus, 1,000, 2,000. And in case series, I gave you a number, 5 to 10 to remember. Follow this and you will never have confusion. I know some people have disagreement. Some will say 20. But I'm giving you, just remember this rule. Many scientists agree with this rule, and this is the easiest rule to remember. 10 patients from 5 to 10 is case series. Only one group. Less than 5 is case study. And more than 10 is a cohort study or a cross-sectional study. And now how do you differentiate between cohort? How do you differentiate between a cohort and a case series? The sampling is done on the basis of exposure. Now, Naushad said, cohort, no one has the disease in the beginning. Exactly, you start with healthy people. They are just exposed. In case control, you start with the patients who have a disease. So in cohort, you don't start with patients. You start with a population. Similar population living in a similar locality with similar exposure, but they are not patients. They are simply people. Case control, you always have patients. Cohort starts with a risk factor. So now, guys, a question. Again, a challenging question. In prospective cohort, you go into the future. In retrospective cohort, you go into the past. In both, you are studying the risk factor. You start with an exposure. Now, come to the case control. In case control, you go into the past. In retrospective cohort, you go into the past. How do you differentiate? In both, you're going into the past. In both, you go into the past and assess there was a risk factor. In both, the disease has already happened. In both, the disease has already happened. Now, are you trapped here? Did I trap you here? We again have two groups. In retrospective cohort, we also have two groups, exposed versus unexposed. Here we have two groups, cases and control. But here exposed and unexposed will also, unexposed will have no disease too. And you already assume that. Okay, so Hadia said in cohort with risk factor and then check for the disease. Yes. In case control, start with the disease and look for the risk factor. That is also right. But I'm looking for an accurate answer. The main difference, same number of people can be there. Both have two groups. In both, you go into the past. In both, disease and risk factor both have happened before. Then what is the difference? The main difference is case control has two groups, right? And cohort also has two groups, exposed and unexposed groups. So aren't you trapped now? Very good point. Cohort looks for incidents, the new diseases. Okay, but now this is not the answer I'm looking for. Let me tell you the secret now. Remember, it's where you started the study. It's where you started the study. Now let me give you an example. I wish I had the board. Let's say this is a line, or let's use this pen. Okay, this is the line. This is the start of the study. That's where you are starting the study. This is the past where the exposure happened. So if you enter the study here, where the scientist enters, and you already have a patient, and you have groups of patients, and you know the patient, you know the disease, you know the patient, you know the disease, and now you go into the past. This is case control. If you don't know when now you enter a study here, disease already happened, patient is not available, risk factor has already happened, patient is not available. You don't know. You entered, now you have to figure out both. What was the risk factor? Was it really the risk factor, and what did it cause? I don't know yet what happened. I don't know the patient. That's retrospective cohort. I'll repeat again. In case control, you know the patient, you know the disease, you don't know the risk factor. You are exploring and studying their past, their clinical history. Now you know the risk factor. Here, you enter, you don't know the patient, you don't know the disease, but you do know the risk factor that you are going to study. Let me rephrase it. You do know the risk factor that you're going to study. Let me give you an example. One of the best examples I could find was, let's say there was an explosion of a poisonous gas. There was an explosion of a poisonous gas in a factory in 1998. And you heard about that explosion in news. So now you know that 23 years ago, there was an explosion in a factory in Florida, for example. And that explosion was of a poisonous gas. So you don't know what happened to those employees. You don't even know the employees. What do you know only? That there was an explosion of a poison, let's say lead. You just know that there was lead poisoning explosion. So you go to a factory, you go to the factory, you meet with the factory owner, and you say, I am a researcher, I'm studying the after effects of that explosion that happened in 1998, where the lead poison was spread all over the factory. Do you remember that? The factory owner says, yes, yes, I do remember that. Yes, I want to study that. Can you give me the list of those employees who were working that day? He said, yes, I would like to speak with them. Then you speak with them one by one, and you found out that that day 60 people were working, and because of that explosion, out of those 60, 25 developed autoimmune disease, some kind of rare autoimmune disease. So you say, okay, so that lead poisoning that day actually caused autoimmune disease in 25 people out of those 60, and 5 have already died out of them. So that means we can say that lead can cause this autoimmune disease. So you did not know these people, you did not know this disease, but you knew that there was an explosion. You knew there was a risk factor. But in case control, you started and the patient was already here. You know the patient, you know the lung patients. You're in the hospital, you know this is a pulmonology ward, and you have lung cancer patients, and you have tuberculosis patients, and you have emphysema patients, or chronic bronchitis patients. So you have all kinds of lung patients here in a hospital. So now you chose cases and controls. You said, okay, I'll study this disease, lung cancer, but what will be my controls? My control could be chronic bronchitis patients. Okay, lung cancer and chronic bronchitis. So remember, the control is not always healthy. Control can always have a disease too, but not that the disease that you are studying. So now you are studying lung cancer, you have those patients, you know the disease, and you have another disease. Now you have cases and control. Now you go into their past by what? By taking history, checking clinical records, electronic medical records, and you found out that, okay, that smoking leads to lung cancer. And the people who had chronic bronchitis is not a good example, right? Smoking is the okay. So let's take TB, tuberculosis. Okay, so tuberculosis versus lung cancer. So tuberculosis versus lung cancer, and you found out, okay, smoking. They did smoking. I did not know what they did. So here you understand, you don't know the risk factor in cohort. You are studying the risk factor, finding out what exactly was the risk factor. You know the disease. Let's go up. Cohort study. You don't know the disease. You know the risk factor. So sampling is done on the basis of risk factor. Here the sampling is done on the basis of the disease. You know the disease. You don't know the risk factor. That's the difference. I can bet on this. Go and ask this question to your seniors, your juniors, your teachers, your professors. Probably less than 0.1% scientists, even who have done these studies, will be able to tell you what is the difference between cohort, retrospective, and case control. So I hope this makes sense. On Saturday, we'll talk about clinical trial. We'll go deeper into clinical trial so you understand that. And then we'll talk about the research question. We'll continue from there so that you can understand what kind of research question should have what kind of studies. And can you have mixed studies or not? We'll discuss that. Everyone is clear now? Everyone is happy now? Any confusion? How was the lecture today? Did you guys learn something today? Anyone who feels that today's lecture was very difficult and I did not understand? Anyone who feels that I am still very bad at understanding research? Congratulations, your concept of research is so strong now. Let's make a quick revision. Case study, 1 to 4 patients. If only one patient, we call it single case study. If 2 to 4 patients, then we call it multiple case study. The hallmark feature of case study is multiple sources of data. Now come to case series. The hallmark of case series is only one group. How many people? 5 to 10. Can we have prospective and retrospective both? Yes. It's all observational. Anything you're studying, whether exposure or outcome, it has already been done. But the sampling is always done on the basis of outcome mainly. Cross-sectional is just a prevalence study, survey study, what is happening at one point in time. But if you study what is happening at multiple point in time, then you call it a longitudinal study. Then comes the case control. In case control, you know the disease, you don't know the risk factor. You know the patient, you know the disease, you don't know the risk factor. In cohort, you know the risk factor, but you don't know the disease. In prospective, you have healthy people, and you know the risk factor, and they will develop disease in front of you. And these studies are so long, they last 40 years, 50 years. There is a study that is still going on that started in 1940s. Yes, there's a study, Firmingen study, Google it, still going on, started in 1940s, 70 years. So cohort studies, generation after generation. It's a long, time consuming study. So cohort prospective, you see the diseases develop in front of you. You knew the risk factor, but the healthy people were involved. In retrospective cohort, you don't know the disease, but you know the risk factor, but you are not including healthy people. You don't know if they're healthy or not. You don't even know anything. In prospective cohort, at least you knew that they are healthy people, right? But in retrospective, you don't even know if they're healthy or not. So that's it. This is how you differentiate between the studies. And this is called the correct study design. I hope the concept is clear, the knowledge is clear. Now, if you have any questions, just send me a message. And I hope you guys had a wonderful session today and you guys learned something, and hope the concept is really clear. And research is no more a difficult thing for you. Okay, guys, see you again. Hopefully on Saturday, we'll compensate for the missed session last week because of my illness or the sickness, I would say. Okay, see you on Saturday. Thanks a lot. Have a good day.